Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hello, I'm Dr. Bernadette Anderson. I'm based in Columbus, Ohio, and I am so excited to be here and to be a part of this circle. One of the things I like to do, or I share with my patients when they first come in, is I like to brand myself as a lifestyle physician because I do firmly believe that most of what we come to see the physician for can be accomplished with changes in our lifestyle, such as, just getting enough sleep or getting enough hydration or, just taking care of ourselves and having grace with ourselves. For me, this transition to more of a lifestyle perspective happened when I was in my office with a patient and I was giving her information about her condition. And I stood there and thought to myself, these things that I'm advocating for her, I actually am not doing in my own life. And I didn't want to be that type of physician. What is good for my patients is good for me. So in that moment, I sort of created a challenge for us, for she and I to sort of pick some lifestyle things. And at that particular time, we both were struggling with obesity. And so we agreed with each other that we were going to take some of these tools and use them to change our weight. And so I learned that going back and dealing with things like unforgiveness in my life, so that was one of the things that kept me going to the refrigerator late at night and trying to soothe, and learning how to set boundaries in my life, being that yes person, not wanting to disappoint anybody. And it was causing distress in my own life. So things like unforgiveness, setting boundaries, learning how to put myself first and not feeling as though I was being selfish, because so many times when we put ourselves first, we are looked upon as being selfish, but it's not. Because if I don't make myself a priority, I'm not able to make my patients a priority and give them the tools that they need. So I share these things in my everyday practice. Most of the time when we come see a physician, we're always talking about which medicine is the right medication. We're always talking about the disease instead of the person. So in my practice of medicine, I want to get down to what's causing the problem. Why are you having hypertension? Is it because you're stressed? And where's that stress coming from? And can we go back and sort of resolve some of those issues so that we don't have to treat the condition with pill after pill, so that the person becomes, a pharmacy instead of actually getting the healing they need from the doctor? And that's key to me. I do believe physicians are healers, and we kind of sometimes go astray, and we start becoming just this person who's writing prescription after prescription without really dealing with that person in front of us and what they're actually dealing with. And so I invite my patient to be a part of the office visit, not just come and sit on the table and wait to hear what I have to say, but to actually engage and be a part and tell me those things that may be barriers or hindering them from doing the things that they know they need to do in order to take care of themselves. I mean, at the end of the day, we're human people trying to do our very best. And when we come to the physician, we need more than just the pill or the prescription that we take to the pharmacy. We need that prescription that we can take home and apply and use in our everyday life, such as journaling and meditation. That's a part of the way I start my day, because I do believe that, when I engage, with myself, and when I'm able to kind of start my day by inviting myself and addressing my needs, then I'm better equipped to handle or um, to manage patient care. And I really stress that with my patients. We're not coming in the office to look for, just a way to mask the problem. But I really think you should use that time with your physician as a way to really engage and to really solve the problem and to address the problem. And when we're not, sometimes we have these ideas about what we think the patient needs, but it is okay to stop the physician and say, listen, these are the things that I'm dealing with, so that we get to know the patient better and we can prescribe things that are more useful in their everyday life. I know that oftentimes, especially as women, we're taught that, we have to be this super person, and we have to be, do everything, everything not just for us, but for our families. And so being able to stop and say, you know what, I don't want to be a superwoman. I want to rip this S from my chest and just be human and just get some of my needs addressed. And that's really important in taking care of our health, because when you look at things like diabetes and hypertension, one of the main things that makes them difficult to manage is the fact that stress is a major factor in controlling both of those diseases. When our stress is up, our blood pressure is going to be up. When our stress is up, our cortisol levels are up. And so that makes our blood sugar be higher and unable to manage our diabetes. So something as simple as managing stress, something as simple as, being hydrated, getting enough sleep, 7 to 9 hours. I know we all think that we can live off 3, 4, 5, or 6, but if we get the adequate amount of sleep and the adequate amount of hydration and be able to manage our stress with tools that are easy and accessible, then we show up different in our lives and in our bodies. I practice this method with my patients a lot, called the 4-7-8 breathing. And for me, it's about just taking a pause. And it's not dramatic. You don't have to have any special equipment, because guess what? We all have our breath, right? You're never going to leave that at home. So just being able to stop and say, look, I need to pause. I need to reset. I need to breathe. It really changes your day. For instance, I had a patient who came in my office with an extremely elevated blood pressure, and my so elevated that my nurse came to another room to pull me out. And when I went into that room and I said, listen, I don't know what you're dealing with right now, but your blood pressure is so elevated that it may require you leaving here and going to the hospital. So before we make that call, I just want to go through a meditation with you. We did the 4-7-8 breathing cycle for 3 cycles. And in that moment, she got to see how just stopping and resetting allowed her blood pressure to come down and avoid a hospital visit. So something just as simple as that, something like art therapy, or coloring in a coloring book, getting back to the basics in our 2-year-old self, where we can be happy and a little bit more carefree, it actually does impact disease processes. There's been research and studies that actually show us this. So using these tools in my practice and actually supporting my patients in using them outside of the practice has been so useful, and has allowed me to not prescribe additional medications. And I'm just excited today to be able to just share that with you. We have so many tools at our really right at our fingertips. And if we can take hold of those things and really use them as a practice, every day. It's kind of hard to tap into these things when we don't really use them every day and we kind of just, pick them up if we think we need them. But when they become a practice, a part of who you are, that's when they're most impactful and effective. And they actually change your perspective and change the way you are able to show up in your life. And, we have so much. Research that proves this. So this is, I always like to say, this is where science meets the soul. So it's not that we're just talking about these things as though they're fluff or, they're these little extravagant techniques that really don't make a big difference. No, this is where actually science does meet the soul. And it's where we can make a change in our health without needing to actually have more and more medications. People always tell me, hey, I want to do it natural. This is how you do it natural. When you show up for yourself, when self-care becomes a priority to you, that's when you actually are doing health in a natural way, in an effective way. So I really wanted to share that with you. That's a part of my story and my practice as a physician.
Oh, wow. Thank you so much for sharing your story with us today. Listening to you speak, I wish I had met you 7 years ago because I would have been one of your patients. I had hypertension
Mm.
and I ended up collapsing with congestive heart failure.
Oh, wow.
So I was going through a very traumatic separation that led to divorce. And it affected me more than I realized. You know how you keep going, you keep going.
Yes,
You're not really aware of the impact of your emotional experiences having on
absolutely.
your health. And they also say that the Black woman is the most stressed human being on the planet.
I believe it.
And we don't realize how much we carry on
Yes.
a psychological level. So thank you for taking your practice in a different direction because I internalized everything. I didn't talk to anyone. I didn't meditate. I didn't exercise.
Mhm.
And I ended up finding myself collapsing in a rice field in Indonesia while I was on holiday. So your mission is music to my ears. You went through a personal experience. Let's unpack that a little bit because that's really what put you on this road. What was it that you were going through? What was it that made you realize that the pharmaceutical drugs wasn't the real solution?
Absolutely. So one of the things I struggled with for the majority of my life was this obesity. And, I tried all these diets and, all these fad diets, actually staying in the gym, exercising. But what I never was willing to do was really to get down to the real reason why I was struggling with my weight. And a lot of it was dealing with this unforgiveness that I was carrying because we feel like if we forgive someone, then we're letting them off the hook. And we're not. We're actually making space for ourselves and not allowing whatever it was to continue um, you know, to manifest in our lives. For me, I struggle with this. With the fact that my father, I felt neglected by him. And so, and I didn't want to let him off the hook. So I used the Haagen-Dazs and the French fries and the everything that I thought was satisfying me to manage what I was feeling emotionally. But when I really realized that what I was dealing with was this feeling of neglect, when I was able to take the person and the situation out of it and deal with the emotion that I was feeling, then I could start to resolve some things. And losing weight wasn't as much of a struggle as it was prior to this. I mean, at one point in my life, I weighed well over 300 pounds. And I realized that a lot of that was coming from unresolved unforgiveness. And when we always hear this, forgiveness is for you, but we don't really necessarily believe that. But it was for me. And I had to figure out how to do that. And doing that for me required not looking at the person and not looking at the situation and dealing with the emotion. And I kind of use that strategy a lot with patients who even come to me with things like obesity. I always say, if you're 5 pounds overweight or 10 pounds overweight, maybe it's just that you need to cut down on your carbs. But when you're dealing with 50 pounds overweight or 100 pounds overweight, there's usually something else going on there that we need to get to the bottom of so that it doesn't have to continue to be a struggle or yo-yo dieting for you.
That is so true. So, how can we encourage patients to prioritize their self care and address the underlying issues like stress and unforgiveness to improve their health outcomes?
Yeah, so how I convince patients to put themselves first is by really getting down to the not just the pathophysiology, but the mind, body, spirit aspect of medicine. We often hear about blood pressure in terms of, just the numbers. But what else is going on that can cause elevated blood pressure? What else is going on that increases the anxiety and the depression? But so for me, it's looking at the disease from the entire perspective of the disease and not just the pathophysiology. In medical school, we're taught, the pathophysiology, but we're not taught this mental and spiritual aspect that goes into different disease processes. And each one of them has some aspect of it. When we're dealing with our anxiety, where is it coming from? It's not just about finding the right medication, Lexapro or Zoloft or any of those medications. It's about getting to the core of where it's coming from. So looking at things from a physical, mental, and spiritual perspective actually allows the patient to see their diseases or their diagnoses from a different perspective, and it gives them a chance to be more involved and engaged in the process of healing and not just the process of medication.
That is just amazing. Now, what strategies can you use to encourage patients to activate participants in their healthcare and to share their personal experiences and barriers?
Absolutely. I think one of the main things you can do is to develop a relationship with your physician. It's just not the person that you're coming to talk about your different medications or conditions. This is the person who you're coming to help you sort of think of them as the person that's going to help you heal your life. So you need to be comfortable with that person. And if you're not, it's okay to find someone who you're more comfortable with, because you need to be able to share everything that is pertaining to a particular condition. I have sometimes mothers coming in sharing with me about, their children and, different things that they're struggling with, divorce or, how tough it is being an executive in these positions and still managing your family. We have to be able to share with our doctor all the things that we're dealing with. And I know that it's not going to all happen in that 15-minute visit, but with each visit, try to think of what else can I add to this so that this physician, this person, this doctor in front of me can help me look at my conditions from a different perspective. And that's really, really important that you engage with that doctor and have a relationship so they're not just seeing you as, here's a person with diabetes, but they're seeing you as, here's this young woman or this gentleman who's coming in who has children and who has an executive position and who's dealing or suffering with diabetes, but they have a very busy schedule. When we look at a person from the entire whole self, then we're better able to provide direction and suggestions, but the less you tell us, then we're left to sort of rely on the medication to help you.
So you're really humanizing and personalizing every experience you have with your patients, right? They're
Absolutely.
not just a number. They're not just somebody who has a specific condition. It's really going in and finding out what is the cause and how you can solve that. So you're not just putting a Band-Aid over it like you do when you take medication, correct?
Absolutely. And I want to say that, yeah, sometimes we do need medication, but sometimes we need more than that. I recall a patient who came in to see me, and I noticed that at this particular visit, her blood pressure was extremely elevated. But then when I sat there and talked to her, there were other things going on. Now she had the responsibility of taking care of a mother who was suffering from dementia. And
Mm,
so she had all of these things going on in her background. The most effective thing that I did with her that day was not add medication, but was to provide resources for her to help with her mother. And she came back a month later, her blood pressure was down. She had things in place and people in place to help her mother, and she was back to her baseline. Now, if I would just went by the numbers, it would have been let me hurry up and add some medication so that I can lower her blood pressure. And that may have helped temporarily, but the point is she really needed other resources and she needed help in a different way. And so, yes, as physicians, we have to look at the person and look at what they're going through and not just the numbers that
mm.
we see in the labs.
Now, you talked about your personal experience with obesity and forgiveness and how it shaped your perspective on the role of emotional and psychological factors in physical health care. As we grow older, as women especially, we find it more and more difficult to shake the weight. I know that my metabolism has definitely changed. There used to be a time where I would just think myself thin, is how I like to put it. And a week or two later, I've dropped 1 or 2 kilos. And now it's not so easy. And it's all around the waist. What
Yes.
advice do you give to women, especially those over 50, in terms of managing our weight?
Well, for one thing, I'm glad you said, you used to be able to just think about it and you would just start to lose weight. And I think we have to change the way we're looking at weight. We're not going to drop weight as easily anymore. Back when you're in your 20s, we always tell patients that, if you lose 2 to 3 pounds a week, you're doing well. But when you're 50, I change that and say if you're losing 1 to 2 pounds a week, you're doing well because you
Yeah.
really do have to account for menopause. You have to account for a slower metabolism. And I always like to share with my patients is that, when we are younger, we have what I term as that cute weight. It goes to the hips and it's looking all cute. Well, as you get older, it becomes that man weight, right? Wrapped across your belly. And so that is just how it goes. But I like to really share with patients is to set yourself up to win. Don't
Yeah.
bring those things in your house that you're going to be struggling with and you're going to be tempted to go back and forth to the refrigerator. And I always hear the excuse, well, what about my children? And what about my husband? Well,
Yes.
I think that they could probably use a few less treats too and make those treats really a treat where you all go out the house and you share and have a good time and enjoy those treats as something rather than something that you're going to your cabinet every day to partake. And so setting up realistic goals is so
Goals.
important. And stop comparing yourself. Don't look at what your husband is doing or what your friend is doing. Look at what you're doing and be okay with what your body is able to do, and just really reward yourself as long as you know you're keeping up with what you said you would do. If that's lowering your carbs, congratulate yourself and don't worry so much about what the scale is saying. Just keep doing it and it will come off.
Yeah, you're right. The only person you're in competition with is yourself.
Absolutely.
And a lot of times we're looking next door to see what the other person looks like, what the other person is doing. But
Yes.
it's you competing with you and doing the best that you can.
Yes.
So, can you share any other specific examples of how you've successfully used techniques like the 478 breathing method or other self care practices to help your patients manage chronic conditions?
Yes, one of the things that I've been very successful with is the art therapy. Um, I was introduced to art therapy by Dr. Murad during one of his retreats, and I remember that because it was so powerful to me when he invited me to go back to my 2-year-old self, where I didn't care so much about what other people were thinking, or I wasn't so worried about what, being successful, but I was just wanting to be happy and laughing and joyful. And so I actually have annual retreats, and doing my retreats, one of the most talked about activities is when the participants or the guests actually engage in art therapy. And it's just really simple. It could be you taking just even so, it could be as easily as you taking a piece of paper and just doodling and coloring on, and just allowing yourself, some freedom and some space to just be you in that moment. At a recent retreat, we used aprons actually, and the ladies just were so engaged. It was just like watching a classroom of second graders, and they were just like drawing these flowers and using all these different colors. But in that moment, they were present. And that is it, being present in the moment. They weren't thinking about what had happened, what is going to happen, but they were enjoying the moment. And that sometimes is a rarity with us because we have so much on our minds and so much competing for our thoughts. But just taking time to be present, to be in the moment, and to enjoy the moment that you're in is just an awesome break for you.
And that's why they say that when you're depressed, you're normally focusing on things that have happened that you can't go back and change. When you're stressed, you're focusing on things in the future that may or may not happen, to a point where you're not present. You're not just enjoying moment by moment as your life unfolds, right?
Absolutely.
Wow. Yeah. Now, I know that you've published a book. It's called Fulfilled. Subtitle, 52 Prescriptions for Healing, Health, and Happiness. Can you give us 5 of those prescriptions that people can take away with this interview?
Yes. So one of them is to learn to laugh out loud. One of the things that my patients share with me, if you come to my office, you're going to hear me laughing, because that's my way of checking in with myself and telling myself actually that you're going to be okay. Despite whatever you're feeling right now, you're going to be okay. Another one is really to learn how to change your perspective and have a positive mindset. No matter what you're dealing with, just try, if you can, to find that silver lining. There's something in every experience that we can reframe and make it positive. And another one is kind of one that I've shared already, but it's so crucial, is learning how to set and maintain boundaries, because sometimes we set them but we don't sort of reinforce our boundaries, and then we find ourselves being last on our list. Another one that's really valuable to me is really learning and including prayer in my everyday life, tapping into my spirituality, and whatever that is for you, that's fine. But we are a spiritual being, and so we have to address and feed our spirits just the way we feed our physical selves. And the other one that I really love is, when we talk about exercise, we immediately go to going to the gym and working out hard. But I love my Wednesdays, because Wednesdays for me is the time where I pour into myself and I enjoy my Pilates class. So learning how to bring that exercise into something that you love and enjoy, and not just something that you're dreading or you have to do, and not using it just as a tool for weight loss, but using it as a tool to just kind of reset, refocus, and just pour into yourself. And so those are 5 of the prescriptions, and I like to call them prescriptions because for me, these prescriptions are equally as effective and as important as the ones that you take to the pharmacy.
Oh, I love it. Absolutely love it. This is such music to my ears. Now, let's teleport you into the past. And we're going to have a little time experiment with my last 2 questions. If I could take you back to go and have a conversation with the younger you, the younger woman who was holding on to something, whatever it was that you went through, that you found you had to forgive, Forgiveness, you are right, is for you more than the other person or the situation that you experienced, right?
Right.
You could go back and give her three nuggets of wisdom based on what life has taught you up until this point. What would those three nuggets of wisdom be?
I would ask her to be authentic to herself. Really focus on what it is that brings her joy and not be afraid to just go for that. I would also encourage her to just not allow situations or people to be a distraction from her goals, but to use those experiences as a chances and opportunity to grow. And more than anything, I would tell her just fall in love with yourself. Just love yourself and allow yourself to be who you were born to be.
Oh, I love that. That is so beautiful. Absolutely delicious. So now let's teleport you into the future.
Yes.
And we are going to go and have a conversation with the 90-year-old you. And she is sitting in her rocking chair, surrounded by her children, her dogs, her cats, whoever is with you at the end. If I could teleport you into the future to go and have a conversation with this wise woman who has led you up until that point, what will you say to her when you finally meet her?
I would tell her that nothing in life is like the end. Like we always think that whatever experience we have is going to take us down, but it doesn't, and it's okay to just experience those things and let it be and to keep growing and to keep living and to just make sure that she is prioritizing those things in life that are really, really important to her. For me, it's family. I love and just reaching out and being with my nieces and my nephews and having them around me and sharing stories and just showing different ways to express love toward each other. And just first, and I've said this to the younger self, and I'm going to say it to the older self, love yourself. Love yourself. That is just so important to me because there were times when I don't think I loved myself the way I should have.
Absolutely beautiful. Wow. Thank you, thank you, thank you so much for coming online and sharing your nuggets of wisdom with us today. This is a message that every woman on the planet needs to hear. I love your holistic approach to medicine, really making people aware that it's not just the drugs that are going to solve the problem. The drugs are just a band aid, but getting to the root of the problem, dealing with your emotions, is halfway to getting you to wellness. Thank you so much.
You're welcome.
And thank you to everybody who's tuned in today. The Her Story Circle is not just a podcast. We are a social impact movement, and we strive to bring you the voices and stories of women from all over the world. We share our stories to inspire you, to energize you, to motivate you, but most importantly, to take you from where you are now to where you're trying to go. Today, Dr. Anderson has given you some tools. She's given you some ideas. You can get access to her book. You can get access to her mentoring, her coaching, her retreats. Please go onto her website and find these healing modalities. Don't wait for things to get to the worst position and then start looking for the help that you need, because a lot of times as women, we wait until the last minute. And that is not a smart way to approach looking after yourself and looking to build a future that is much better. So I'm going to share her website at the bottom of the screen. If anybody out there is in need of help, is in need of inspiration, is in need of tools, there is one place you can start immediately. So I'll be back again tomorrow with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And bye for now. And thanks again for the interview, Dr. Anderson.
You're welcome. Thanks for having me.
Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep